This presentation summarises the findings of the JSNA Wakefield Adults Annual Report, focusing on those aged 18 and over living in Wakefield District. The Joint Strategic Needs Assessment, usually shortened to the JSNA, is a continuous process by which local health and wellbeing boards across England assess the current and future health, care and wellbeing needs of the local population to inform decision making. Wakefield's Health and Wellbeing Board members include representatives of Wakefield Council, local healthcare and other organisations such as police and housing, whose work contributes to people's wellbeing in Wakefield. Information that makes up the JSNA is available through the Wakefield JSNA website. It includes data on health conditions affecting the Wakefield population and factors which can influence health. These include deprivation, housing, smoking and education, and highlights where there might be inequalities for some groups. It also includes information from two major surveys, the Wakefield Adult Population Health Survey and the Wakefield School Health Survey. Each year, two JSNA annual reports, one for adults and one for children, provide an opportunity to focus on the most pressing health needs in Wakefield District. This report summarises the findings where further investigation may be needed. It highlights the local population, district characteristics, health behaviours, population groups and health protection. A PDF copy of this report is available on the JSNA website for further reading. The PDF copy includes interactive links. Just click on the More Info links to be taken to web pages with more detailed information. Within the report, the comparison is made between the picture in Wakefield and other areas, including national and regional figures. Colour coding is used to show whether Wakefield is worse, in line or better than the comparator. There are just under 283,000 adults in Wakefield. Over the next decade, the population aged 75 and over is projected to increase to almost 40,000, which shows an ageing population that is also being seen nationally. The proportion of the adult population from ethnic minority backgrounds has increased to just over 10% in 2021. People born in Wakefield are not expected to live as long as those born in other parts of the country. Both males and females have lower life expectancy than the England average. Further context to the JSNA annual reports can be found in the State of the District report. This report gives more information about the people and places in Wakefield, including living environment, economy, housing and education. The next section highlights some of the areas of health that are important to consider in Wakefield District that affect adults. To support the aims of the Wakefield Health and Wellbeing Board to improve the health of the population and reduce inequality, we asked an independent research agency to conduct a population health survey of adults living in Wakefield District. The full survey report can be found using the More Info button or on the JSNA website. It includes a wide variety of topics affecting adults in the district. A few measures are shown here. For example, 59% of respondents reported to be in good or very good health, which is lower than the 2021 national census where over 80% described their health as good. The survey data has fed into lots of analysis and work areas since the survey was carried out. A look into the individual JSNA topics such as the LGBTQ plus population, neurodiversity and living with obesity include detailed analysis of the survey data. These can also be found on the JSNA website. Cardiovascular disease has been a significant issue in Wakefield for a while now. The under 75 mortality rate from all cardiovascular diseases is higher than the national level and is a lot higher in men than women. Stroke prevalence in Wakefield is also higher than the national level. The percentage of people with type 1 or type 2 diabetes is increasing both locally and nationally, but it is also higher in Wakefield than the national level. There is variation in type 2 diabetes prevalence in West Yorkshire, with 4 in 10 people living in the most deprived areas. Wakefield has a higher percentage of people with asthma than that seen nationally, and under 75 mortality from respiratory diseases are also higher than national levels. The prevalence of chronic obstructive pulmonary disease, or COPD, has been decreasing in Wakefield in recent years. However, it still remains higher than the national level. More than 3/4 of adults in Wakefield are living with overweight, which includes obesity, and although this is an issue nationally, Wakefield is higher than the national level. Again, the level of obesity is higher in the most deprived areas, and living with obesity can affect other areas of a person's life, such as their mental well-being and sleep quality. Mental health is crucial for overall well-being, and good mental health supports a productive daily life and coping with challenges. 1 in 5 adults in Wakefield have a low mental well-being score. Younger adults and those living in more deprived areas were more likely to have a low score. 1/3 of adults in the district said they experienced anxiety, and 1/4 experienced depression when asked about long-term conditions in the Adult Population Health Survey. The district mortality rate from suicide is higher than the national level, and Wakefield has the second highest rate of suicide in the Yorkshire and Humber region. Dementia is a syndrome associated with an ongoing decline of brain functioning, which is most likely to affect people in older age groups. 2,700 people aged 65 and over are living with a dementia diagnosis in Wakefield. That's around 4% of this age group. With an ageing population, it's predicted that there will be an 80% increase in dementia by 2040. Sexual health is a person's physical, emotional, mental, and social well-being in relation to sexuality. Priorities for this area in Wakefield cover a wide scope, including access to condoms for young people, sexual harassment and violence, and advice and support for older people. Chlamydia rates are compared to an aspirational benchmark for detection. An increased rate is indicative of increased control activity. It's important for chlamydia to be treated as, if left untreated, it can lead to longer-term issues, particularly in women. Wakefield was under the benchmark for 2022, but within the amber range. Gonorrhea rates have increased locally and nationally since 2020, and has been one of the main sexual health priorities for the district this year. The next section highlights some of the health behaviours that are important to consider in Wakefield district that affect adults. 61% of adults in Wakefield are physically active, according to the Healthy Life Survey. However, only half of respondents to the Wakefield Adult Population Health Survey reported doing recommended weekly amounts of activity. Physical activity can have significant benefits for both physical and mental health. Only 1 in 5 survey respondents said they eat 5 or more portions of fruit and vegetables a day. However, there are barriers to eating healthier food in Wakefield, with half of those that eat less than 5 a day saying cheaper fruit and veg prices would help them eat more, and 1/4 saying that more time to prepare meals would also help. Smoking prevalence in the district has declined over the last decade, although it is still high. Around 1 in 8 adults smoke in Wakefield. People in deprived areas of the district are 4 times more likely to smoke than those in more affluent areas. 1 in 8 adults in Wakefield reported that they vape. Of those, almost 3/4 said they would like to stop. 3 in 5 adults in Wakefield reported that they drink alcohol at least once a week. Of those who drink, around 1/3 were classified as hazardous or harmful drinkers, and alcohol-related mortality in Wakefield has been consistently higher than national levels over the last 3 years. Drug misuse is defined as the use of a substance for a purpose not consistent with legal or medical guidelines. Just under 3,000 people in Wakefield use either opiates and/or crack cocaine. Wakefield had the highest rate of deaths from drug use in the Yorkshire and Humber region in the 3 years from 2020 to 2022. Wakefield district includes different population groups. It is important to look at outcomes for these groups in relation to other groups and the general population to identify any inequalities or issues that may affect some people differently to others. Just under 1/4 of adults in Wakefield were identified as being disabled in the 2021 national census. Around 1 in 10 people reported to be disabled and limited a lot in their daily lives. 3% of adults in in the Wakefield Population Health Survey identified as having a learning disability, although local GP practice registers show less than 1% of adults with a recorded diagnosis. Neurodiversity regards differences in brain function and behavioural traits as part of normal variation in the population. It can include autism, ADHD, dyslexia, dyspraxia, and neurodevelopmental conditions. It's estimated between 10 and 20% of the national population may be neurodiverse. Some people need little or no support, whereas others may need more help. It's likely that neurodiversity is underdiagnosed and self-identification is becoming more common as neurodiversity awareness increases. Wakefield has a Gypsy and Traveller population with some community members living on the Heath Common Traveller site. The community face a wide range of issues with national and local data showing that they experience lower life expectancy, a long history of discrimination, poorer health outcomes, and barriers to accessing health services. Unpaid carers provide critical support for people with health and social care needs. The support provided by carers is often physically and emotionally demanding, with consequences for carers' own health and well-being. Just over 1 in 10 adults in Wakefield are unpaid carers. Unpaid carers had different outcomes compared to the non-carer population. They were more likely to be living with obesity and experience issues accessing support for health conditions. Half of unpaid carers reported having poor sleep quality. The number of people living with visual and/or hearing impairment is predicted to increase over the next 2 decades. Wakefield has a higher rate of people registered blind or partially sighted, glaucoma, and sight loss certifications when compared to national levels. People with any hearing impairment reported worse general health and independence than the general population. Health protection focuses on safeguarding population health against external threats, providing protection and preventative care. Screening and immunisation programs are an important part of preventing ill health, identifying conditions early and enabling timely treatment. Bowel and cervical cancer screening coverage in Wakefield is higher than national levels. Nationally, breast cancer screening levels dropped in 2021 during the COVID-19 pandemic from over 40% and have remained at a similar level. Recent data shows that breast cancer screening coverage in Wakefield dropped below the national level in 2023. Vaccinations are critical to help protect against potentially life-threatening diseases. Vaccination coverage across Wakefield District is generally similar to or above the national level for adult vaccinations. However, some population groups have lower coverage levels than others.